My name is Kirsten. I'm a local peer support breastfeeding counselor, as well as a fairly new international board certified lactation consultant and the mother of 5 children. I've also been quite involved with the Breastfeeding Action Committee since its inception 10 years ago, and in the last year and a half or so we've started to really build our capacity in Edmonton to make change so that breastfeeding becomes the norm instead of the not norm. So I want to welcome you first and thank you so much for coming this evening. Tonight's event and tomorrow's seminar are the work of an incredibly dedicated group of volunteers who are passionate about breastfeeding and also about addressing a large gap in our current health system. Tonight we are going to hear a few stories from local parents who, with their children, have struggled with breastfeeding and other issues because of tongue ties and lip ties. I will start with a brief overview of tongue and lip tie in Alberta and tell you the story of my friend and colleague, Leanne Grenier. We will also then get to hear, after a few other people tell their stories, from Dr. Kotlow himself, who's come to us from Albany, New York, to give us his amazing expertise on this subject so that we can do a better job in Edmonton and in Alberta and the Prairie provinces to serving families here. There are a number of common themes in the stories tonight. You will first and foremost hear about breastfeeding difficulties, painful latching, damaged nipples and poor weight gain. You'll also hear about dental caries, difficulty eating complementary or solid foods, speech issues, reflux, aspirations, infections, nursing aversion, nursing strikes, and inability to bottle or cup feed as well. You'll also hear about mastitis, probably, and plug ducts. The list goes on. The frustrations parents have navigating our health system in their attempt to get help for their child are huge, and the emotional toll on families cannot be ignored. Although it is difficult to estimate the number of cases of tongue and lip tie in our population, we know that our awareness here is growing. Research estimates that 4 to 10% of the population has a tongue tie, but definitions are not consistent, and rarely is a posterior tie included in that number. Before the 1940s, revision of at least anterior ties was commonplace. As breastfeeding rates decreased, tongue tie revision disappeared. Bottle-fed babies also struggle with tongue tie, but you can more easily force-feed a bottle-fed baby. As of April 1st, 2011, the Canadian Pediatric Society came out with a recommendation on the revision of tongue tie for breastfeeding, stating, "Ankyloglossia, or tongue tie, is a relatively uncommon congenital anomaly defined by an abnormally short lingual frenulum. Associations between tongue tie and breastfeeding problems in infants have been inconsistent and are a long-standing source of controversy in the medical community. Definitions of ankyloglossia vary, and management suggestions are not based on randomized controlled trials. Surgical correction involves cutting the lingual frenulum, frenotomy. Based on current available evidence, frenotomy cannot be recommended. If, however, the association between significant tongue tie and major breastfeeding problems is clearly identified and surgical intervention is deemed necessary, frenotomy should be performed by a clinician experienced with the procedure and with appropriate analgesia." I wonder how they get the experience if you shouldn't do it. More definitive recommendations regarding the management of tongue tie in infants await appropriately designed trials. This, although it came out on April 1st, was not an April Fool's joke. The recommendation is very frustrating for those of us who work with breastfeeding women. Nothing in the commentary around this recommendation mentions laser revisions. Most of the research they used for the recommendation is over 5 years old, much of it even older than that. No dental research was used, and a quick Google search doesn't indicate any breastfeeding expertise on the committee. One of the physicians even has significant ties to the infant feeding industry. Yeah. Why, in the case of tongue tie and its impact on breastfeeding, is a 4 to 10% incident rate, if it's that low, considered uncommon? Those of us providing support to mothers who are breastfeeding see the impact of tongue tie frequently, and it makes sense. Currently, we're in a baby boom. In 2010, almost 53,000 babies were born in Alberta. Our birth rate by population is significantly higher than any other province. Of these babies, most initiate breastfeeding. However, we see this drop off dramatically within the first few weeks of life. Even if only 5% of babies born in Alberta have tongue tie, that's still almost 2,700 babies. If the number is closer to 10%, then we're looking at over 5,000. Research suggests that babies with tongue tie are 3 times more likely to be bottle fed by the end of the first week of life. Most of us who support breastfeeding mothers don't see those babies in the first week of life. So we're not seeing most of the people with babies with tongue and lip tie at all. They have stopped breastfeeding before they've ever found a breastfeeding support group or a lactation consultant. The 2 top reasons for premature weaning are not enough milk and pain. Both of these things go hand in hand with tongue and lip tie. Breastfeeding support groups and private practice lactation consultants likely see no more than 1,000 mothers a year. If you do the math, it just makes sense that we see a lot of babies with tongue and lip tie. Most of these mothers are not accessing any specialized breastfeeding help, and they just quit breastfeeding. The mothers who come to us are deeply committed to breastfeeding. They often find us after seeking out help in many other places. They are nursing despite pain and poor weight gain, and often feeding babe 3 different ways. I'd like further research on this, but one article suggested that 25 to 60% of all lactation consultant clients are dealing with tongue tie. Anecdotally, other experienced LCs suggest that it's up to 75%. We know that tongue tie has a genetic component, and we also know that it's found almost twice as often in boys than in girls. We don't have a sudden epidemic of tongue tie, and it's not just a new fad. Breastfeeding works, and when it doesn't, tongue tie is one of the most common culprits. Once we start looking for it, we do find it everywhere. Mukai and Asoka said in 1993 in their research on tongue tie that tongue tie patients live in a state of stress. Over the last 20 months, I've seen this firsthand as I've learned more about ankylosing through the journeys of many of you who are here today. This, for me, started 20 months ago with the birth of Elijah Grenier. On December 18th, 2010, I had the wonderful privilege of attending the birth of my friend Leanne's 3rd child. When she sat with him skin to skin on her chest, he started to do the crawl to the breast. However, even as he was opening his mouth, Leanne turned and said to me, "Look, he has a tongue tie." Sure enough, he didn't really latch for the first 3 days of life. He would refuse the breast, and when she could get him on the breast, his latch was shallow, painful, and he'd pull up quickly. She saw her family doctor when Elijah was 5 days old to have it clipped or revised. She had spent the first days of his life hand expressing and using a nipple shield because of the pain and damage. After this first clip, and it was just a clip, Elijah nursed immediately and finally started to transfer milk. For the next couple months, as long as she was able to nurse truly around the clock, even more than we would normally see with a young baby, Elijah seemed to be doing okay. But after a couple months, she realized that he was an easy baby because he was sleeping all the time. She started taking him to get weighed and realized that he wasn't nursing much, wasn't nursing well, and when he was, and he wasn't gaining weight. And in fact, often he was losing weight. She started pumping. He often wouldn't nurse at all, but also couldn't cope with a bottle or a cup. She would painstakingly syringe feed him 3 milliliters at a time. She couldn't leave the house because he wouldn't eat the whole time she was out. She saw a number of clinicians to try and get his tongue tie revised again. She was told not to nurse him at night, and that was the only time he would actually nurse well. She was told to start feeding him steak at 4 months. He couldn't handle a bottle, he couldn't handle the breast. How on earth was he going to handle steak? And she also told him was told to just pump and feed with a bottle he couldn't cope with any better than the breast. And almost no one would look in his mouth. She got a prescription for domperidone, pumped all the time, and used a supplemental nursing system at the breast, as well as syringe feeding him. He would nurse at night sometimes, but when he got sick, which was happening frequently, he would refuse the breast completely and lose weight. The more weight he lost, the sleepier he would be, and the more compromised was his nursing. It was an uphill battle to keep him going. She saw more than one IBCLC, multiple pediatricians, speech-language paths, multiple emergency room doctors. She would tell them he wasn't peeing, about the uric crystals in his diaper, the refusal to eat, The weight loss, the sleeping, the constant illnesses. And always she would be told, he's doing okay. If you stop feeding him, he'll eat when he's hungry. If he was doing worse, we might do something. Or, conversely, if he doesn't do better, we'll need to get a feeding tube. No, I won't refer to the plastic surgeon. I'm learning so much from you. Just keep doing what you're doing. Everyone said they were learning from her, myself included, but no one would actually do anything for this baby. The dozens of health professionals who saw Elijah dismissed Leanne's concerns and ignored the fact that he was often demonstrating signs of failure to thrive. The fact that all babies deserve a breastfeeding relationship, that pumping and syringe feeding is time-consuming, and they also dismissed the intense emotional toll. The whole experience was full of anxiety. There was so much apprehension around everything. He would latch, and she'd count the seconds he stayed latched. She'd count the swallows, how many times a day he was on the breast, and his wet diapers. And she would hide her pain from him and didn't talk about it with anybody else. Nursing was constantly painful, and yet it was many months before I realized that she was still hurting when she was nursing. Her focus was always on Elijah. If she could meet his needs while in pain, so be it.